Hello and welcome to Talking Healthcare, Knight Frank's go-to podcast series for all things related to healthcare and healthcare investments. My name is Shazad Jamal, and I'm the partner in the Strategy and Consulting Division for Knight Frank in the Middle East region. I'm joined with my colleague, Dr. Girish Kumar, who is the sector lead for healthcare in Knight Frank. Today, we're going to be talking about the healthcare landscape in Ajman and the Northern Emirates. And join me is Mr. Akbar Moideen. Hello and welcome. And we talk about Ajman, we talk about the growth in the healthcare space. We're talking about so many things that are happening within the Northern Emirates with all this investment coming through. Would you like to share with us, your point of view when it comes to the changes in the healthcare landscape, and and how does it compare within the different emirates within the northern side of the country?
Thank you, first of all, Shazad, for inviting me. And let me talk to you not just about Ajman, but the Northern Emirates as a whole, and what Thumbay Healthcare has offered and is offering in the Northern Emirates. So, Thumbay Healthcare is the first private academic healthcare network in the entire GCC region. We started as a single hospital back in 2002 in Ajman. Uh, Ajman had a very small population, close to 150,000 at that point of time in 2002.
Wow.
And my father, who set up Thumbay Group and Gulf Medical University, like you said, the first private medical university in the region, set up a 150-bed hospital in Ajman. To everybody's surprise, where the largest hospital at that point of time was in Abu Dhabi, was a 50-bed private hospital, or in Sharjah, again, a 50-bed private hospital. This was quite new, where we set up a 100.
It's really bold, right? 150 beds for 150,000 population.
Exactly. So when it comes to setting up, people ask, why do you set up such a huge hospital
Yeah.
for a population size that is not as big as Abu Dhabi or Dubai? And the reason is that we're not just your ordinary private hospital. We are an academic hospital, which means that we do much more than just clinical services. We do research, we do teaching, so students get rotated across these hospitals, clinics, pharmacies, etc. And we do a lot of research work. So this is the differentiating factor between us and other hospitals in the region. Of course, Ajman since then has grown drastically.
Yes.
Today, Ajman is close to 500,000 population in Ajman itself. And Thumbay Healthcare itself has grown across the Northern Emirates. So we have a large presence in Sharjah, Ajman, Fujairah, Ras Al Khaimah, Al Quwain, which constitutes the Northern Emirates. And Northern Emirates, when you look at it, the population strength is close to 5 million, which is half of the entire UAE's population.
Yeah.
And Northern Emirates, the uniqueness about Northern Emirates, you were asking me, what's the difference between Dubai, Abu Dhabi, and the Northern Emirates? The Northern Emirates still today has no compulsory or mandatory health insurance.
Yes.
Which means that close to 50% of our population is either non-insured or doesn't have access to healthcare facilities or have to pay out-of-pocket cash payments when it comes to healthcare. And this is all about to drastically change, The government has already announced, the rollout of the mandatory health insurance for the Northern Emirates. And January 1st onwards, it is going to be mandatory for everybody to have health insurance in the Northern Emirates.
So is it going to be in the phased manner similar to Dubai and Abu Dhabi, or is it slightly different?
And the phases has already started.
Okay.
So visa renewals are not happening without insurance currently. And we are expected that the Emiratis and the local population will have the insurance rolled out from January 1st, 2025 onwards.
Which will give them the option to come to private or public, irrespective.
Correct. Yes. So access to care is something that we're going to see that's going to be drastically changed. How this compares, again, you should ask me, what happened in Abu Dhabi or what happened in Dubai when mandatory health insurance was rolled out. So what happened in Abu Dhabi was when a patient or a citizen used to go to a hospital once in a year, that drastically increased to 9 times a year in Abu Dhabi.
Yes.
And in Dubai, that increased to 4.5 times in Dubai. So what's going to happen to the Northern Emirates? Similar numbers. There's going to be a drastic increase in the outpatient visits and, subsequently the IP visits as well into the hospitals because of this mandatory insurance. The difference again between the Northern Emirates, Abu Dhabi and Dubai is the pricing. So Abu Dhabi is at 900 dirhams per patient, the basic plan that we call it. Dubai was at 450 to, I mean, it's at 600 dirhams.
Yes.
The Northern
600.
Emirates is expected to be around 400, which is lower than Dubai. So coverage will be not as good or not as much as Abu Dhabi or Dubai, but you have a large population that is finally getting access to healthcare, which is, of course, a positive sign for everybody.
Yeah, but I think there is another thing that we would also need to consider, and Dr. Girish, you can also chime in, that a lot of the population of Ajman and Sharjah are actually living in Dubai and probably had access. So at least their spend patterns, and whether when they're unwell, they're willing to go for private care and all these sort of things. Do you see that?
Correct. I mean, you're saying that many of the population is living in Dubai, but you have the opposite way around as well. So you have many of the population of Dubai living in Ajman and Sharjah. So we've we've been able to deliver care to this population. But yes, like you said, we have some data on the usability, the type of need that care that is required for these populations already.
Yeah, I mean, because if you see, as Dubai is growing, a lot of this population is also trickling into Sharjah and Ajman mainly.
Yes.
That's where you see the maximum growth. So if you look at Sharjah and Ajman, along these growth corridors of the Mohammed bin Zayed Road, you see a lot of new developments happening. Sharjah, which is towards the airport. Ajman, if you see, there's a lot of development happening that side. So as the population grows in these areas, you need new healthcare, facilities here. Now, these could be your standard, multi-specialty hospitals, but also because a lot of these, people coming to these regions are predominantly from Dubai or working in Dubai at some point, they have insurance. So the access to healthcare is good. So there's also going to be this demand for center of excellence concept, which Ajman has, but mostly, I mean, as in even Northern Emirates has, but it's mostly within hospitals. You don't have so many standalone facilities like you have in Dubai. So I think that's going to change when we go, when we see this growth happening. You'll see that change happening where you would see more specialty care coming in. There's a growing population of senior citizens, in these areas. Some of them actually, especially in the national population, they seem to have access to healthcare already because some of the daughters, sons, they work with the federal government, so they're covered from Daman. So that's another area that you'd see more demand coming.
Another area that we are addressing as Thumbay Healthcare as well, because we have close to 100 beds dedicated for long-term care and rehabilitation.
Right.
This caters to mostly geriatric patients or rehab patients, and we are able to, and we are excited that people are utilizing these services already. One of the things that we pride ourselves in is that we have a rehabilitation hospital, which is the number one rehabilitation hospital in the country. So we still cannot believe that Ajman has such a fantastic facility, and people all over from Abu Dhabi and Dubai are coming to use this hospital. What we do is complete robotics when it comes to rehabilitation. So you have paraplegic patients who are able to walk again in certain areas, certain cases. We have various treatments like cryotherapy, hydrotherapy, pools, and things like that, which are very exciting, very, very useful, especially for geriatric patients.
Absolutely, absolutely, and I've also seen your facility myself, so I can vouch for it.
Yeah.
Yes, definitely.
Exactly.
But I mean, the thing is, I think a good thing is that we established one thing, that there are actually two things really. One is that there is a gap that needs to be met, and insurance will help achieve that. I mean, so there'll be more demand, and now we're also saying that there is an element of centers of excellence that might actually also come through, but from your point of view, and from your point of view, where do you see the not skill, as in where do you see the service gap or the specialization gap in Ajman or in the Northern Emirates, where you say, what, if this is an area that we really need to focus on, this is probably next move.
Absolutely. So let me tell you again about the healthcare offering that we offer currently, and that what gaps we are trying to fill as well. We offer everything when it comes to the healthcare segment. So right from your home care to primary care, where we have clinics across these Emirates, primary care clinics. Then we have daycare hospitals. We have secondary care hospitals, like in places like Fujairah, where the hospitals are secondary care, and then they get referred into our larger hospitals in Ajman or Sharjah, for example. We also have tertiary care hospitals,
Correct.
which has everything to do, with where there's cardiology, where there's neurology, and then we are building the university hospital as we speak. You've seen the
Yeah.
facility. It's as it's in terms of utilization, we're utilizing only 40% of the capacity of that hospital, and there are various specialities that are yet to be added or developed further. Some of those specialties that we're developing is oncology, for example. See, oncology is a big shortage when it comes to the Northern Emirates.
Right.
Today, all the patients either go towards Dubai or Abu Dhabi for treatment when it comes to oncology. So oncology is one area that we are developing, and we are aware that once compulsory health insurance comes into the Northern Emirates, this is an area that will be utilized and will be required, and that's what we are developing. So we've set up the first Thumbay Advanced Oncology Cancer Care Center, and we're developing that as we speak. We also see a large population that requires specialized care when it comes to neurology and orthopedics. Again, these are specialities because of the demand that is suppressed when it comes to not having insurance. These patients, if required, usually tend to go to Dubai for these treatments. Now that you have insurance, you will definitely look for treatment closer to home, and that's what we are developing as well when it comes to these specialities.
Doctor, I mean, you've done a lot of work in the region,
Yeah.
especially in the Northern Emirates. Where do you see the gap actually?
I would say mother and child care specialties, IVF specifically, because that's an area that we are seeing growing throughout the UAE, but especially in the Northern Emirates, we are seeing a lot more gap in this because you don't have a lot of established players in this space. One of the areas would be mother and child.
That's again where we come in.
Yeah.
We in terms of Thumbay Healthcare, we are one of the largest delivering hospitals in the region. We deliver in one of our hospitals. We used to deliver close to 650 babies a month, and that was the largest
Yeah.
delivering hospital
Exactly. No, yeah,
in the
that's-
country.
650 babies.
Yeah.
which is very unique. Again, why do people opt us? I want to say that being a teaching hospital, we feel that the doctors carry a certain level of expertise that is not available in other hospitals. So we have professors, we have lecturers, etc., who are actually doing the delivery. And on top of that, being a university hospital, our prices are comparatively lower. So
Yeah.
when it was cash pricing across the UAE, our prices were always lower than the competition as such, than other hospitals, because we are attracting volumes. We want more volume so that students are able to observe. Students, let me clarify that students are not practicing medicine as such. They are mainly observing patients. They're taking notes and things like that. So they support the doctor
Yeah.
when it comes to treatment.
As a proper
such.
ecosystem,
Yeah.
and they need to go through this process in order to actually become practicing doctors going forward.
Exactly.
You talked about all these services. Then, but the thing is to talk about the patient journey, and then the other thing that I found quite interesting was the metaverse.
Mm.
Do you want to shed some light on these
Yeah.
two interesting?
Okay, so again, when it comes to, you all know, our tagline, and my father is very specific about this, because what he believes in is that we've always been innovative. So in Thumbay Group's motto and our culture and our tagline, it is growth through innovation. So we have always been very innovative when it comes to whatever we try to do. So one of the things that when the metaverse was becoming a big thing, and today AI is a big thing. So metaverse was one of those areas that we jumped into. Metaverse. We basically built out the first metaverse hospital in the world. We were the first hospital in the world. So what does it do? It's a hospital that is available to you to go into in the metaverse. You wear your VR glasses. You can walk into Thumbay University Hospital in the metaverse.
Yeah.
Today, the thing is that what we are trying to develop further is the use case scenarios of this metaverse
Yes.
hospital.
Yes.
You can have a consultation with a doctor, for example. But what more can you do? That's
Right.
where we are trying to come in and say that this is something that we'll be able to do further as the metaverse develops even further. When it comes to AI, today, our focus again is gone into AI. AI is something that is going to transform. AI has always been there. We have algorithms in many of the activities that we do, but AI is going to transform the way we deliver healthcare, and we want to be on top of that.
Yes.
So again, from the university side, we've introduced the first institute for AI in healthcare. It's the first one in the region. We are starting undergraduate programs and postgraduate programs. What we're trying to tell y'all or people is that, today your mobile phone knows more about you than your wife or yourself.
Just a fact,
It
yeah.
knows that you went to certain restaurants.
Yes.
So today, for example, if
And-
you had a stomach pain, you can actually, the mobile algorithms today can actually tell you that you went to this restaurant, and I think there was, many people are complaining about food poisoning who went there, and you should actually see a gastroenterologist. Or we can advise you the closest hospital to see a gastroenterologist. Or we can actually prescribe certain treatments when it comes to, and this is what we are trying to develop and keep up with. So the next generation of doctors is not going to be, textbook savvy doctors who know what's there in the textbooks. The next generation of doctors is the ones who will be able to develop the algorithms going forward that can treat patients, and we are developing those doctors, and we want to be ahead of the curve when we develop these systems and processes.
Yeah, and it's very important. I mean, at the time when value-based healthcare is the most important topic for everyone,
Yeah.
I think this is very important because this reduces the cost in the system itself when you're trying to, make more consultations remote. You don't need to come into the hospital unless and until it's important. Right? You can, for your basic conditions, you can be treated. For your chronic cases, you can be treated on these kind of platforms. Which makes a difference.
I think we need to have a separate section on this
Yeah.
metaverse business, because I would really want to understand that, if I walk into Thumbay in this metaverse thing, what would happen?
You won't get rejection,
yeah,
but-
how far can we go? I think that's probably something for another day.
Yeah.
But you talk about experiences, you talk about costs, you talk about all these things. That I think the obvious next question is medical tourism.
Yeah.
Right. Dr. Girish has been talking about medical tourism. We've been discussing medical tourism. Ajman government actually came up with a whole plan for promoting medical tourism, right? And there is what do you call? And we are attracting people from different parts of the world. And like Doctor, you were mentioning the other day that there are so many people from Africa and the other regions, and even from the subcontinent actually coming here, which previously was never the case.
Yeah, it's interesting, right? Because I was seeing the numbers published by the Dubai Medical Tourism, which is the only entity which is publishing some numbers on this. And you'd be surprised that most of the patients come in from Asian countries, especially India and Pakistan, So that's the more leading bit. And then you have the Arab countries because you have people from GCC and MENA region coming in. And then you have European countries, which is not something you'd expect. So typically you would have expected Africa to be right up there because it's close. But you're actually seeing countries from these regions come in more and do treatments such as dental, dermatology, gynae, so IVF I was talking about, seems to be one of the hottest in terms of specialties that people are accessing over here. And then you have your specialty like orthopedics and neurosurgery and all that. But those are still building. I think UAE is in a stage where you can build this out. Previously, we were always known for aesthetic and all these elective procedures. But I think we are moving towards that place where they come in for more complex surgeries now. So I think I'm sure your group is seeing that as well.
So again, when it comes to medical tourism, so we were the first people to look at inbound medical tourism back in 2007. Our initial Ajman hospital basically started looking at bringing in patients into the UAE, where at that point of time, people were just looking to go outside UAE for treatment. There was not enough, specialities that were available in the UAE that people used to go outside. Today, that scenario has changed. UAE has some of the best hospitals, some best doctors available in the UAE. So where are we getting these medical tours from? Like Dr. Girish said, a large population comes in from India and Pakistan, mainly because of the resident population of this country has a large Indian population as well. But targeted approach, I would say we still target Africa because of the facilities that are not available in Africa. India and Pakistan to a certain extent has those facilities, but Africa still has a dire need for these facilities. So we target patients from Africa. who come in for everything to do with orthopedics, plastic surgeries. We have a lot of patients coming in for a simple health check.
Yeah, it's very interesting because the thing is that the average income level in the continent actually is improving. The middle class is actually, especially in the eastern side of Africa, they're making a lot of progress, and for that they want quality healthcare, and that's one of the prerequisites. And historically they've been going to the West as well. I mean, who could? But now with this middle class population, there's so much to grab onto. But are you seeing any people from Eastern Europe as well, or
Absolutely,
European
yes,
regions
we
as well?
are. I mean, we are. In terms of one of the things that UAE offers that other countries are not able to offer is high quality care.
Mm.
Dubai and UAE as a whole has the largest number of hospitals accredited by JCI and international organizations globally,
Yes.
which is a very unique feature. And this is all credit goes to the government. The government has been enforcing quality almost from the beginning of the UAE. I mean, healthcare now, hospitals cannot basically renew or exist without a quality international accreditation. And that changed a lot. So, because of that, you have huge inflows of patients because of the quality of care. So, people in healthcare, especially, I want to say that, they don't mind paying a little bit more. I want to say that UAE is cost effective, but we are more expensive than most of our competitors. But we offer quality that most of our competitors cannot offer. And that's the reason that people choose us over other countries. Let's talk about Thailand, for example, or India. We are able to offer that quality that they're not able to offer, and that's why patients are coming to us now.
And is there like the follow-ups and everything? What sort of steps are you taking? I mean, because once the patient has gone through, let's just say, a surgery or something, then there need to be follow-up
Correct.
visits or follow-up, let's say, if not even visit, but consultations, etc. So what is it that?
So we do two types of follow-ups. One of them, of course, is through our telemedicine system. So patients can easily access our doctors from wherever they are
Yeah.
using the telemedicine option on our hospital information system. But other than that, we have collaborative doctors in these areas. These are our, I want to say, referral doctors. So they take care of the patient at the home country. So we have many of these across Africa, across Eastern Europe, who basically take care of patients once they go back there. And they are in touch constantly with our doctors as well in how to continue that care.
Yeah, which is very different. I mean, if you look at the mass market medical tourism, that's where I think the gap is because the follow-up care is missing. Patients go back and then no one follows up, or there's just not enough attention given after. So that's where I think UAE differs because you have that follow-up mechanism. You can, try and get in touch with patients and make sure they come back when required.
Yeah, and we're only 4 hours away from, I think,
Exactly,
majority of the
yeah,
world.
exactly.
So, and connectivity and all these sort of things really do help. Plus, of course, I would also say the supporting infrastructure is also good for the caregivers, etc. So, the quality of life, etc., makes it a very appealing place. Not only for care, but for any other activity. But now that we're talking about the infrastructure, we've talked about all these sort of things. Uh, I know you're a busy person. I won't take much of your time, but there is one last question. There are so many visions that the countries have come up with, the Emirates have come up with, and GCC countries. So we understand that you have a vision 2028, which talks about doubling Thumbay.
Yes.
What is that?
So again, of course, we are aiming to double the number of patients that are currently being seen by Thumbay Healthcare. We see almost 5,000 patients a day, and this is going to double for sure by 2028. And these are through various initiatives. I want to give credit, like you said, Ajman government itself has come up with a medical tourism plan, and we're working very closely with Ajman Tourism to make sure that this happens. We are adding facilities, we are adding specialities, we are adding a system that is going to be improved into a certain way, and at the same time make sure that we keep our patients in priority. At the end of the day, we're doing all this to cater to a patient base that prefers to come to us or prefers to use our services, and that's what we're trying to do.
This is quite interesting. I know we're slightly short of time, But I want to thank you so much for this, and I hope that we can have another session on the metaverse,
Absolutely.
because I really, really am interested to see how it's going to change the space, the healthcare space in the country. Well, there you have it. We had an interesting conversation with Akbar. We talked about the healthcare space in Ajman, the gaps, impact of insurance, artificial intelligence, and a little bit of metaverse. Thank you very much for watching. See you in the next episode.